at the doctor's office. And this is the surgeon's office. I'm at OSHU, that out there. This is the Ross, I believe that's the Ross Island Bridge. Yeah.
Okay, everybody, I got the videos from the scans. So I've got the one from 2016 or 125, January 25th, 2016. This was my initial scan after I had got the infection in on the tumor, and it just got out of control. So this is basically what I looked like back then. This is the imaging test. They make you take the radiation contrast that actually provides an image for them of what is, the areas that are infected. Now, what I learned about the contrast is that any organ in your body that actually moves, it's constantly moving, like your prostate, down here is my prostate, my kidneys, my stomach. Anything that moves on its own is going to light up because, they tell you to stay perfectly still when you're doing the contrast. So any organ that doesn't move on its own is not going to light up. Now, cancer is active, so what happens with cancer is it moves regardless of whether you're moving or not. So it's constantly active. So that's why they call it activity. New activity, no activity, that type of thing. So, your brain is constantly working, so that's going to light up. My stomach and the adjacent parts to my stomach, my kidneys are going to light up, and my prostate's going to light up. But here is the cancer. So the back of the throat, these are the tonsils, one side, the other side, and then this is the tumor, the lymph node on the side of my neck. And if you guys remember, that thing was pretty freaking big. As a matter of fact, it was it was huge. Okay, so this is on January 25th, 2016, right there. And it looks actually pretty bad. So you can see the back of that's the side, my side, the back of my head, the tonsil area, the lymph node on the side of the neck. Okay, so that's that area. Okay, guys, and this is my video, the scan from my recent scan, which is actually the 16th of September, so September 16th. And as you can see, where the lymph nodes lit up before, they are no longer lit up, and the back of my throat is no longer lit up. There's some lighting in the tongue area, but the doctor, actually, I'm going to play the video too, or not the video, but the soundtrack of the doctor, because I actually recorded our conversation, and he explained why the tongue lights up. And it's because even though they tell us to be still, we are still moving our tongue inside our throat, or inside our mouth. Even with our mouth closed, we still move our tongue, and because we do, the tongue lights up. But as you can see, this area here is no longer lit up. There's no activity on this side, no activity on that side, and there is no activity on the back of my throat. In other words, where the actual tonsils used to be. But the same areas light up. The stomach and the adjacent areas to the stomach, the kidneys light up, and your prostate, and your brain. Because those are organs that just you can't stop them. They have to move. So they actually absorb the contrast, and then that lights up in the radiation scan. But as you can see here, I am clear in terms of any cancerous activity on these areas where the cancer used to be. So this is a very, very good, this is an excellent scan. This is an excellent test, and it's an excellent outcome. And as you'll hear from what the doctor is talking about, it's fantastic. So with that, I'm just going to cut out and just leave you with this image, and then we'll play the conversation with myself and the doctor.
Right, I did. Yeah.
The problem is that after all this radiation stuff that you've done, you can't move your tongue.
Right.
And so what happens is people sit there,
But the tongue's moving.
and their tongue's moving, and when your muscles
And my
move,
tongue was moving. I know it was.
yeah, and when your muscles move,
Mm-hmm.
then they light up on the PET scan. That's why they ask you to let it grow still.
Right.
And the thing that you really notice when you see this, and I've seen this before many times, is
Mhm.
that the whole tongue lights up. It's
Right.
not like a focal area of the tongue. It's like the whole thing lights up.
Right.
And the radiologists, look. Actually, the radiologist commented on it.
Yeah.
But also commented that they thought that it was more likely to be muscular activity than tumor.
Okay. Yeah.
The other thing is that this is an area that's very easy for me to see and feel, and so
Good.
I'm not that worried about it. But
Because I don't feel anything hard, and it said in there that there's no mass.
yeah,
So, and there's never been tumor. Dr. Slough always pushes on my tongue, to feel if there's anything hard.
yeah, there's never been tumor in your tongue, and everything else looks.
And if you look at the original one, there's light in that one too, in the tongue area. So, I'm happy.
they didn't spray any stuff in your nose, did they?
Not yet.
That's what you are.
I mean, I'm so happy you turned me on to both of those doctors. Are amazing. Dr. Wong and Dr. O'Brien. They hung with me, and they didn't pull any punches. They told me how it was. They said this thing is gonna take. It's either gonna take or it's not gonna take.
I think it took.
Yeah.
I'll be with you in a second.
Okay, I'm ready.
So you like Slough?
Yes, he's freaking amazing.
But wasn't it Porter that sent you to me?
Or was it Slough?
No, it was Dr. Birmingham who sent
That's
me.
right. That's right. In Newburgh.
Yeah, Dr. Birmingham sent me to you because he didn't want to. At that point, he was just too out of his control. He saw it, he looked at it, and he was like, "No, you got to go see. You got to go see a specialist."
Stick your tongue out.
Ah.
Yeah, it's like gone.
Yeah, it's that was the first thing I saw. The tonsils gone. I was like, no way. And I was like, I didn't even feel it. I just looked in the mirror one day and they're gone. What happened to them?
I just want to feel your tongue.
Okay.
Don't bite it. Yeah, I'm as positive as I can be that that's not cancer.
Good. That makes me feel better. It's a little sensitive.
So aside from the business with your tongue, what did Wong and O'Brien have to say about the?
Well, Dr. Wong called me and kind of went over the findings, and he said that that the levels that they were when I went in there, I guess they rate them on a memory level system or something, and then the left side where the actual node was, the lymph node, was like a 17 or something
Before the treatment.
Before the treatment,
Yeah.
and he says now it's less. It's like 3.5. And the same with this side over here was a little high, but this one went down to like a 2 or 3 or something. And he says basically that's just almost normal baseline activity. And still, because of the size it was, I freaked everybody out. Everybody when I went into the radiation ward the first time, that like they never seen nothing like that. And then for me to go back in after, just for these follow-up visits, everybody wants a picture, and, because they have the original picture when I went in there. So I was feeling great. And then I read the bottom part of that report, and it's like, oh God,
You're
cancer's on the tongue.
you know cancer in your tongue. I was actually very impressed by the pictures. I mean, I saw the thing in the tongue, and I kind of like, oh, that doesn't look too bad. The area of the tonsil is completely normal. The stuff on the right side of the neck is basically gone. really nothing obvious on the left side of your neck cancer-wise, but there's a lot of scar and stuff like that.
Yeah.
In there. And so I think.
I mean, it was pretty bad originally. It was very bad, and I could imagine there's got to be some scar tissue. My freaking throat still hurts, and it's been 3 months after treatment.
So, you know, I think what I want to do is talk with Dr. Wong about you, and see, because one of the things that comes up sometimes, especially in somebody who's had a lot of disease in their neck initially, is whether you should go in after the chemotherapy and radiation and do what's called a neck dissection, which means kind of cleaning out all the residual stuff that's there. And this has been.
That'll deform me,
It's not going to make you any prettier.
Right. But I mean, are you going to take the muscle too? And
you know,
it depends on.
I would advocate against it.
Mm-hmm.
You know, this has been a debate that we've been going over for 20 years since we started treating these things with chemotherapy and radiation. It used to be that when somebody came in with a small lymph node, we always went in and operated on them afterwards. Okay? And we don't do that anymore because in those patients, they almost always, there's nothing there. It's just, you know, scar tissue and stuff like that. Even in some of the bigger nodes nowadays, we tend to sit tight on people. And I've gotten away from the routine, operating on people routinely, mainly because, you know, it tends to be a difficult operation for me because there's a lot of scar in there. And I think it's a little bit more difficult for you just because I think the risk of injury to various nerves in your neck is increased because of all the stuff that's there. And you know, you're right, there's probably a pretty good chance that I would need to take that muscle out to do this. Mainly because even if there's not cancer there, there's going to be scar tissue all over the place and stuff. Now, I mean, losing that muscle it's not the end of the world. And you can get by without it.
It's just disfiguring too.
It's a little bit disfiguring. The real thing I worry about is after all this radiation and chemotherapy that you've had, sometimes you have some difficulty with wound healing afterwards. And it hasn't happened in a while, you know, but I have had a couple of people over the years who you do this operation and then the wound just kind of falls apart afterwards.
Because it doesn't heal properly.
Yeah, and then the problem is that you're left with kind of exposed blood vessels and stuff in the neck, and you have to do something to get those covered up, or else they may burst and people can bleed and stuff like that. So I'm actually pretty happy with the way that that's doing those.
Thanks for just freaking me right out, man. Jeez.
This doesn't happen.
Tell me like it is. Don't pull any punches, doc.
It doesn't happen if you don't operate.
Right.
I mean, what I'm actually thinking of is because I'm actually pretty impressed with the response you have.
I am too. I'm like shocked that I'm looking. I mean, I've got some lymphedema going on, you know, because everything's, I guess, coming down this way now, and I have to, you know, do the massage here on it. And I've got a jumper thing that I'm doing, and it works. I mean, honestly, it takes 5 minutes, 10 minutes, and it actually starts moving that fast. So,
well, what I would propose is that instead of charging in with an operation in your neck, maybe we wait 3 or 4 months and repeat your PET scan.
okay,
That will also look at the tongue.
that sounds good.
And then make our decision there. And I suspect I have another guy like you, but I have another fellow who had a similar sort of thing, and he's about 3 years out. And every time I do a PET scan on him, his tongue lights up like that. And he lives down in Roseburg, and the radiologist down there, every time I get reports, it says, you know, like there's a gigantic tumor in the tongue. And the guy comes in, he's like, I feel fine. I'm eating fine, I'm working, he's talking fine, his tongue's totally normal.
Did he have his taken out too? Surgery or no surgery?
He did not, yeah. Now his tumor was actually in his base of tongue. His
okay.
tonsil, but very similar disease. And so in him, I finally got to the point where I'm like, we're just not going to check PET scans on him anymore, because every time you can't not move your tongue, and everybody gets all worried. And he's like 3 years out, so he's okay. Why don't I talk with Wong?
Okay.
And then I'll call you.
Okay.
And let you know what he says.
Okay.
But Probably I'll get to tomorrow, Friday. I'll find next week.
Okay,
Okay.
that sounds good.
Yeah, you're great.
Because if I don't have to do surgery, believe me, but like I said when I first came in here, I trust your, you know, you said, I asked you straight out, you know, what would you do? And you told me, you know, you go get the chemo and go get the radiation. And the first thing that Dr. Wong said is that that's what he would do. Because these, he's actually shrunk tumors, but he's never seen one like mine. But you know, he said the thing is that it's either gonna work or it's not gonna work.
Yeah.
You know, bottom line. And it was like the first 2 weeks, I was like, God, this isn't gonna work. And then when it started shrinking, I was like, holy crap,
Yeah.
it's working.
I actually kind of thought it was going to work.
Yeah, I knew you did because you said it was. You said that normally they shrink them down and you don't have to get surgery. You don't have to.
Yeah, I've seen tumors bigger than
Good.
yours.
Good.
You're not a record.
All right.
Okay.
Okay, I'm
All right.
happy. Thank you very much.
All right.
Appreciate it.
You working?
No, actually, I'm on disability right now
Okay.
because, well, for a number of reasons. Because I was in the hospital, I had a tube here, I had a pick here, it's like I couldn't do anything. But anyway,
I'll talk to you next week.
I appreciate it. Thanks, Doctor.
Take it easy. Glad you're doing well.